Neck contractures. Today we are going to discuss about what is neck contracture, how does neck contracture occur, problems arising due to neck contractures, and what is the treatment for post-burns neck contractures. What is neck contracture? Scarring in the neck area which while healing causes a progressive tightening of neck skin causing a neck contracture. The neck bends forward or in a flexed position, limiting straightening or extension of the neck. How does neck contracture occur? Neck contractures result from injury to the neck skin, most commonly due to burns to the head and neck area. These are usually thermal burns, can be scalp burns or electrical burns also. Also, surgical scars placed vertically down the neck can also become contractural bands, limiting neck extension. As burns heal, scars form, scars contract, and that results in a scar contracture. Now let's look at what are the problems arising due to a neck contracture. Neck scars on healing become thick, elevated and tough and form hypertrophic scars or keloidal, which look ugly and unaesthetic. Neck contractures cause flexion or bending of the neck. It limits straightening or extension of the neck. As the tension in the neck scar increases, it gets transmitted to the skin of the lower lip, chin and angles of the mouth, pulling these landmarks downwards. This can cause eversion or pouting of the lower lip, exposure of the lower gum line and lower teeth, with bands of scar tissue going vertically down from the angles of the mouth. In extreme cases, the chin may get stuck down to the chest with loss of neck curves, that is, effacement of the angle between chin and neck. Psychological component of this sequelae is quite significant. Neck contractures cause a lot of depression and low self-image. Neck being an exposed body part, contracture of the neck is unaesthetically quite unsightly. What are the treatment options for neck contractures? Treatment options include preventive modalities and therapeutic ones. Preventive treatment is that which is administered during the phase of acute burns, which includes bandaging the burn wounds with neck in extension, grafting the burn wounds primarily during the acute burns, and not waiting for them to heal spontaneously. This will minimize the chances of hypertrophic scars. Using a neck splint like a collar to keep the neck in the extended position for at least 2 or 3 months post-burn injury or post-grafting will minimize the amount of contracture and recurrence of contracture. Now, what are the therapeutic options for established burn contractures? The main principle of surgery is release of contractures completely, attaining a complete extension of the neck with resurfacing of the raw areas with a skin graft or flaps. Under general anesthesia, patient's neck scar is excised and all the tight structures like skin, soft tissue, fascia, scar bands and underlying muscles are released to get a maximum extension. Resurfacing can be done with a graft or a flap. Problems with using skin graft are that they do not give a good color match with the rest of the neck and face area. They are prone for recontractures because the grafts themselves contract with time. However, resurfacing with flaps is a very superior option, giving permanent release of contracture with no recurrence. It gives a very good aesthetic match with the rest of the head and chest area. Surgery is the only solution in providing a good long-term relief to such patients with a functional and aesthetic outcome.